Hey there guys, Milka with mamasreviews.com, and I recently joined Smiley 360. So in case you want to scan the QR code and find out more. And I recently received a first product so that I can let you know more about it. I am a mother of 5 children and ranging ages from 4 months, well almost 5 months, all the way up to 9 years. And this is a product that I received. This is children's Advil. It's designed for children ages 2 through 11. It's dye-free. It's white grape flavored. Let's see. And the active ingredient is ibuprofen. It says 100 milligrams. It's a fever and pain reducer. I do want to share some information with you, so hopefully you'll bear with me. A little booklet that I received. And what this booklet goes through is some signs that you can look for to know that your child might be sick, but maybe not as sick as you think. Some signs that let you know that you should get into contact with your doctor. Talks about colds, what you can do to help your child feel better, and it talks about also prevention. So I'm going to go through this booklet here. I won't be too long. And hopefully I'll be able to help somebody in sharing this information. Okay, so it starts off: positive signs that your child may not be as sick as you think. If your child is still interested in playing, if your child is eating and drinking well, is alert and smiling at you, has a normal skin color, looks well when his or her temperature comes down. Those are some things that you can look for to know that your child is probably not as sick as you think. Some signs that you should look for to know that you should call your doctor include if your child is experiencing discomfort, is vomiting, is not drinking, is not sleeping well, has a temperature of 101 degrees Fahrenheit or higher, and is 2 to 6 months old, or has a temperature of 103 degrees or higher and is 6 months or older. If your child has a very bad headache or experiences persistent diarrhea, you should get in touch with your doctor to see if you need to bring your child in to the emergency room or whatever. Okay. It says, a question in the mix: why do children seem to get so many colds? Actually, a child will probably experience more colds and upper respiratory infections than any other illness. In fact, it is common for children to catch 8 to 10 colds within the first 2 years of their lives. It may ease your mind to know that many colds go away by themselves and do not lead to anything worse. So that's good to know. Just, you want to make sure you keep your children warm, especially colder months like these. Make sure you put an undershirt on your child. If you can get thermal pajamas if it's cold where you live. Also socks or house shoes. Make sure your child keeps something on their feet at all times. That's something that my dad really used to emphasize when we would get sick. You need to put something on your feet. You want to make sure you don't overdo it because, they'll cause sweating, and then sometimes at night it gets a little bit cooler. The air hits, and then your child ends up getting sick as a result. Okay, the main ingredient helping your child feel better, it says for fever, don't over bundle your child, which is what I was just talking about. It says, in fact, dressing your child in light clothes may help body heat to escape. Oh, this is actually if your child has a fever. You want to kind of give the child time to sweat the fever out. You don't want to put too many covers on your child if your child has a fever, because it could actually make the fever worse. It says a lukewarm bath may also help to lower fever. Giving your infant or child the appropriate dose of infant's Advil or children's Advil, depending on your child's weight and age, can help bring down fever and relieve pain, and you want to make sure you use products as directed. For stuffy nose, did you know that saline or salt water nose drops can help thin nasal discharge? Simply place a few drops into each nostril, followed by a gentle bulb suction. Ask your doctor what saline drops would be appropriate for your child. Using a cool mist humidifier or vaporizer in your child's room can help moisten the air and clear your child's nasal passages. For children 4 years of age and older, decongestants are excellent over-the-counter options to relieve a stuffy nose. Okay, for chest congestion, something as simple as chest physical therapy can help loosen your infant or child's mucus. It says lay your child across your knees, face down, cup your hands, and gently tap your child's back. This also works if your child sits on your lap with his or her body leaned forward about 30 degrees while you gently tap on the back. That's good to know. That's new for me, so something that I can try out whenever my child catches a cold again, either one of my children. It says a cool mist humidifier or vaporizer can also help relieve your child's chest congestion. For children 4 years of age and older, an expectorant is also an excellent over-the-counter option to relieve chest congestion. For a cough, a key ingredient for a cough is honey. It is sometimes given alone or can be found in some cough products. It is not safe to give honey to babies younger than 1 year old. If your child is older than 4 years, cough drops or lozenges can help soothe his or her throat. Remember not to give more drops than directed on the package, and do not give them to a child younger than 4 years. For children 6 years of age and older, an antitussive is an excellent over-the-counter option to relieve cough. And here are some ways that you can prevent your child getting sick. Wash hands with warm water, not too hot or too cold. Always use soap. Wash hands for at least 20 seconds, and that's about as long as it takes to sing an ABC song. Always wash fingernails. Make sure to rinse all the soap off, and always dry hands thoroughly. Other ingredients to help prevent future illness include work with your child's doctor to make sure your child is up to date on all the vaccines. Avoid touching the nose, eyes, and mouth, and cover the nose and mouth with arms, not hands, while coughing or sneezing. Because if you cough with hands, a lot of children have hand-to-hand contact, and that kind of helps to spread germs. So if you cough here, then you're not going to likely have contact with that area there. So these are things that are really good to know. I'm going to see if I'm missing anything else. Okay, it says, add a pinch of serenity. Staying calm while your child is sick can make a difference. A recent literature review has shown that fever and pain in your child could be a significant source of anxiety for you. This, in turn, may lead to increased anxiety for your child and an increased perception of pain, which may make treatment more difficult. By reducing your own anxiety, your child's anxiety may also be reduced, which in turn can aid in the recovery process. The more facts you know about a fever, a cold, or the flu, the more calm you may be when comforting your sick child. Did you know that nothing reduces fever faster or keeps it down longer than children's Advil? Children's Advil also provides up to 8 hours of relief. You can also feel confident knowing that children's Advil is both safe and effective when used as directed. It is important to remember, always read and keep the carton for complete warnings and information on infants' Advil and children's Advil products. Always use a dosing device that comes packaged with the medicine, and adult-strength medicine should not be administered to children. And that's pretty much it. In the back of the book, there's a dosing diary, which is pretty neat to have, so that you can keep up when you gave your child medicine last, so that you don't give your child too much. And it looks like infant Advil is designed for infants aged 6 to 23 months. Designed to reduce fever, relieve minor aches and pains, due to common cold, flu, headaches, and toothaches. Also available in dye-free white grape. Then there's the children's Advil for children ages 2 through 11. And then there's junior strength Advil, which is for ages 6 through 11. The junior strength is available as tablets that are chewable. So here's this. This is just the information that I read. Looks like you can find Advil on Facebook. I don't see a direct link here, but I'm gonna just show you this again. This is the children Advil. Again, this is my first campaign with the Smiley 360, and I'll put this up again just in case you didn't catch the QR code the first time. Alright, you can find a QR reader, free QR reader, in the Android or on iTunes. And that's about everything for that. So thank you again for watching. Hopefully I shared something that's going to help you out next time your little one gets sick. Take care.